I'm sure that many of you know, or at least have a family member or friend that knows, the excruciating pain of the topic we will be discussing today. Today we will be talking about kidney stones. Did you know that kidney stones can range from the size of a grain of sand to the size of a golf ball? I have this demonstration here to show you just the different sizes of kidney stones. As we can see, this one is roughly 1 centimeter long, which may not sound like a lot, but it's excruciatingly painful when it has to pass through your urinary system. And with all the sharp edges, it can cause some serious bleeding. According to National Health Services, 1 in 10 people are affected with kidney stones at any point within their lifetime. 7% of females and 13% of males are affected. Unfortunately, I fall under the 7% of females that have been affected with kidney stones. And as anybody else with kidney stones can tell you, they are no joke. Today, I want to inform you on how kidney stones are formed, what are the pain and the symptoms of kidney stones, and the prevention of kidney stones. So let's start by talking about their formation. According to Mayo Clinic, kidney stones are formed by a chemical imbalance. This chemical imbalance is usually caused by an excess of calcium, oxalate, or uric acid within the kidneys. This excess causes the fluid to dilute ineffectively and results in a crystal-like stone that is formed in the kidneys. Now, depending on the size of this stone, they can either be passed through the urinary system or they may have to be surgically removed. There are no direct cause of kidney stones. However, there are some factors that may influence your chance of getting them. These factors include your genetics, so if you have any family history of kidney stones, dehydration, certain types of diets, obesity, digestive diseases and surgeries, conditions relating to the urinary system such as UTIs, and certain types of medications. Now let's discuss the pain and the symptoms of kidney stones. As we've previously discussed, kidney stones are incredibly painful, and they usually affect the flank and abdominal regions of the body. They have often been compared to childbirth, and according to many women that have had children and have also had kidney stones, they're not far from it. Now, as we can see from this diagram, this kidney stone is now entering the ureter. And kidney stones actually don't cause any pain until they are moved around in the kidneys or until they move into the ureter. The ureter is the tube-like structure that connects your kidneys to your bladder. So now we can discuss some of the symptoms of kidney stones. Some of the symptoms include pain that fluctuates in intensity, a burning sensation when urinating, cloudy or foul-smelling urine, persistently needing to urinate, nausea and vomiting, and fever and chills. Now we can discuss how to avoid kidney stones. According to Harvard Health Blog, some people just cannot avoid kidney stones because they are just genetically predispositioned to them. But there are some ways that can decrease the likelihood of developing kidney stones. They can decrease their likelihood by making sure that they are staying hydrated, eating foods that are rich in calcium, limiting your sodium intake, and avoiding foods that are rich in oxalate. These factors can also improve your blood pressure and your heart health. So not only are you preventing your chances of getting kidney stones, but you're also having a positive influence on your heart. In conclusion, today we talked about what kidney stones are, how they are formed, the pain and the symptoms, and how to prevent them. We discussed that kidney stones are formed by a chemical imbalance within the kidneys that lead to a crystal-like formation. We also talked about how the pain is comparable with childbirth, and it usually affects the flank and the abdominal regions of the body. 1 in 10 people will get kidney stones within their lifetime. Recognizing the pain, symptoms, and prevention are all important factors and are just as important as going to the doctor to treat them. Thank you.